Well, we are in for yet another treat, and that is a presentation on broadband access issues and implications for elders. It's my great pleasure to introduce to you our next speaker. Ann Byers is the eHealth and Communication Information Technology Manager for the Nebraska Information Technology Commission. In her role, Ann Byers supports both health IT and broadband initiative in the state. Since 2018, she has worked with Nebraska's Rural Broadband Task Force to develop findings and recommendations for the legislature. She administered 2 health information exchange grants from the U.S. Department of Health and Human Services, Office of the National Coordinator for Health Information Technology, and that was from 2010 to 2014, and then again in 2015 to 2017. She also provides support to the Commission's advisory groups on community technology and e-health issues. Ms. Byers has a bachelor's degree in journalism from the University of Nebraska and a master's degree in human resources education from Boston University. She resides in Lincoln with her husband and her 2 needy dogs. Are they really needy, Ann, or are they just trying to bring out the many gifts that you possess?
That's a nice way of saying that.
Very good. Well, I would ask you to please join us in welcoming our next speaker, Ann Byers. And Ann, you have a clicker that's available to you.
Okay, great. Thank you.
Very good. Thanks so much.
Okay, I think I'm set up here. Can everyone hear me? Okay, great. Hi, my name is Ann Byers, and I'm delighted to be here today to talk to you about broadband access issues and implications for elders. Now, I spend all day at work talking about broadband and thinking about broadband, but I suspect that most of you do not. So I'm going to start with a definition of broadband to make sure that we're all on the same page. The simple definition of broadband is high-speed internet access. So from a consumer perspective, if you can stream video at home, if you can participate in online programming like this, on Zoom calls, if your children can participate in online learning, then you probably have broadband. If you struggle with those kinds of applications, then you probably do not. If you're interested in a slightly more technical policy definition of broadband, broadband is internet service of at least 100 megabits per second down and 20 megabits per second up. When we talk about up, that's data that you are sending. So like if you are emailing somebody a big file, or if you're working at home on a VPN and you're saving a file to the servers at work, that's uploading. And that's actually where people seem to have the most difficulty with their broadband speeds, is that upload speed. Broadband technologies can be broadband can be provided through a number of technologies, including fiber, cable, fixed wireless, and satellite. And then many of us also use our phones for broadband access, for mobile broadband. So it's great to be here at an educational event like this that's using broadband, because it really, I think, brings home the importance of broadband and how we're using it today. So I'm going to start out with an overview of my key points. The first is that broadband availability and adoption is very important for our economy, communities, and health outcomes. The COVID-19 pandemic and current labor shortages have certainly accelerated the use of online services and applications. This has been going on for a number of years, but just in the past couple of years, we've seen a huge acceleration of that. Those who are not online are likely to pay more, wait more, be unable to access some services, and experience poor health outcomes. And those over 65 years old are the demographic group most likely to be digitally disconnected. Reasons for not being online include not having a broadband connection due to lack of availability or cost, not having a device, not having digital skills, or simply just not wanting to be online. Fortunately, federal and state funding is available to address barriers to digital connectivity, primarily broadband availability, but also factors related to broadband adoption. And you can participate in the development of state digital equity and broadband deployment plans to ensure that these plans really reflect the needs of your communities and the needs of older adults. So now I'll address these points in more detail. First, broadband is important for our economy. There are a lot of studies that show the importance of broadband and the relationship of broadband to economic growth. And I'm just going to cite one. A 2021 Deloitte study found that increased broadband penetration, and by penetration we mean subscription, that people are actually subscribing to broadband, greater broadband availability, and greater penetration or subscription again of higher speed broadband lead to economic growth. I think it's certainly easy to see the impact of technology in places like Omaha and Lincoln that have a lot of tech startups and that have a growing tech ecosystem, but broadband is also important for Nebraska's rural communities. Rural broadband availability and adoption are associated with attraction and retention of millennials, greater economic growth, attraction of new firms, higher household incomes, and small business growth. Broadband is also important for agriculture. A report from the USDA found that fully adopting next generation precision agriculture technologies in the U.S. would result in annual gross benefits of $13 billion for row crops and $20.6 billion for livestock and dairy. And agriculture is certainly important for Nebraska's economy. The market value of crops and livestock produced in Nebraska in 2017 was nearly $22 billion, with a per farm average of nearly $475,000. So it definitely has a huge impact on Nebraska's economy and our communities. And we need economically strong communities to provide services that aging adults need. Broadband is also important for health. It allows us to research information on medical conditions, manage appointments and prescriptions, check lab results, participate in telehealth consultations, and even to participate in home health monitoring. And I've been telling people for probably 10 years that home health monitoring is going to be the killer app for home broadband. And I've been waiting and waiting and waiting, and I think we're finally at that point where that is coming true. There are a couple recent studies that have really shown the impact of broadband on health outcomes. The first one showed that places with lower internet subscription rates had higher COVID-19 mortality rates, especially in urban areas. And I think that is really kind of a very striking and even shocking finding. But it makes sense, because if you do not have internet access, it was much harder to find good information about COVID-19. It was harder to make an appointment to get a vaccination. It was harder to access routine health care. It was harder to communicate and stay in touch with family and friends, all those things that keep us healthy physically and emotionally. A second study found that COVID-19 patients who had used a remote health monitoring portal had a 32% lower rate of hospitalization on average than other COVID-19 patients. So a very significant reduction. And portal users that did require hospitalization were discharged from hospitals 2.7 days sooner on average. So another significant impact. And actually, older adults, you would think that maybe they would shy away from participating in the portal because they may not like technology, but that was not true. They actually were more likely to participate in the portal group. So on average, I think most older adults really do like using the technology. So broadband is also important for accessing services. You know, since COVID-19 and now the current labor shortages, we've really seen an acceleration of the use of online services in healthcare, but also in other areas. And it's really making it much harder for those who are not connected. Those who are online can more easily apply for Social Security retirement benefits, apply for economic assistance, apply for a job, price match or use coupons, and we just don't get coupons in the paper or in the mail like we used to. Avoid a long line at the DMV. You can now schedule appointments, get directions. How would we get by without our directions on our phones? Book a flight or a hotel room or check in for a flight. It is really hard to make a hotel reservation now over the phone. If you try and call like the number that's listed on a website, it takes forever to get to a person who can actually take your reservation. It is not easy. Go to the College World Series. The College World Series this year required electronic tickets on cell phones. That was the only way you could get into the College World Series. Or even to go to Rocky Mountain National Park. Right now, Rocky Mountain National Park requires an online timed ticket, a timed entry reservation, which is only available online. So you cannot go to Rocky Mountain National Park unless you are online. To park, there are quite a few parking lots, especially in city centers and downtowns, that only take electronic payments. And then the most surprising use, perhaps, is to use a restroom in Norway. Norway has a lot of pay toilets, pay restrooms, and in some locations, the best way to access it is through a mobile payment system. Apple Pay was very useful in that situation. So that's kind of my quirky little use of the internet. But in short, life is just harder for those without internet connectivity, without devices to connect to the internet, and the skills, technical support, and privacy security protection needed to access the internet comfortably. I want to talk a minute about devices. Many of the apps that I cited require a mobile device. But for some applications, like applying for a job, applying for benefits, maybe making travel reservations, it's much easier if you have a bigger screen and a full keyboard. So depending on how an individual is using the internet, how they're using broadband, full connectivity might require two different types of devices and two different types of connectivity. Now we're going to talk a little bit about digital equity. And digital equity is the goal of achieving parity in digital participation in the economy and society. And I'm going to mention that one more time. I'm going to repeat that because you may see this later on a quiz. Digital equity is the goal of achieving parity in digital participation in the economy and society. So it's simply making sure that everybody can apply for a job. They can apply for benefits. They can participate in health monitoring programs or go to Rocky Mountain National Park. Older adults, unfortunately, are far less likely to not be online. They are 3.5 times more likely to not be online. Pew Internet found that 25% of U.S. adults 65 years or older do not use the internet, compared to 7% of U.S. adults. So that's a striking difference. And actually, if you break down older adults, it's those that are probably 80 or 85 and older that are truly the least likely to be online and that are the most challenged with using the internet. And my parents fall into that age group. So here are some figures for broadband subscription rates by age group, and this is for Nebraskans. So those 65 years and over are far less likely to have an internet subscription or broadband subscription than younger adults. Only 70.1% of those 65 years and over have an internet subscription in Nebraska, compared to 93% of those under 18 and 90.5% of those 18 to 64. So that's a considerable difference. Here's some data from Pew Internet showing smartphone ownership and tablet ownership by age group. And again, you can see that there's a significant difference in the percent of adults 65 years and over who own a cell phone, only 61%, versus 96% of those 18 to 29 and 95% of those 30 to 49. And then if we look at tablet ownership, we also see a significant difference in ownership by age group. Other groups lagging in digital connection include those with lower incomes, those with lower levels of education, those with disabilities, and those who live in rural areas. Some minority populations are also less likely to be online, but that's a little bit more nuanced. There are many reasons that people give for not being online, including broadband isn't available, broadband isn't affordable, they don't have a device, they're just not interested, and they don't know how to use a computer, tablet, or smartphone. And again, it's usually a combination of those factors, those reasons. And so digital equity strategies really need to address all of the reasons for not being connected. I think it's also important to note that there are people like my parents who have an internet subscription, they have broadband at home, they have iPads, they have devices, but they need extra support to use a lot of technology. They're not very comfortable with it. And so I would really like to give a shout out to the Nebraska Department of Health and Human Services State Unit on Aging for their partnership with Get Set Up. It sounds like a great program. Get Set Up offers online training opportunities for adults age 60 and over. They have starter classes to help adults get familiar with the technology and with the program. And they have online telephone technical support going on during all the classes to deal with the technical issues that older adults may encounter. So I think that's a great program to address some of the barriers to connectivity and to encourage adults, older adults to use the internet, to learn and to interact with others. Now I'd like to go through and talk about some of the barriers to digital participation, and certainly in rural areas, one big barrier is broadband availability. This map shows where broadband is available in Nebraska. The orange areas are areas that have broadband. The unshaded areas are areas lacking in broadband of 100 megabits per second down and 20 megabits per second up. This map is certainly not perfect. It is widely criticized. It probably overstates coverage, and the data is about 18 months old. But thankfully, the FCC has been revising the way they collect data and how they map it, and so we should have a better map of broadband availability in November of this year. So we're looking forward to that. And that will be very important because there's a lot of funding becoming available for broadband, and having better maps will help us better direct that funding to the areas that need it most. And now I'm going to talk a little bit about some of the funding that has been available and is available and will be available. Starting with in 2020, Governor Ricketts allocated approximately $29.5 million in CARES Act funding for broadband, and that really demonstrated that there was a need for additional funding for broadband and that funding made a difference. The state legislature appropriated $40 million in state funding for the Nebraska Broadband Bridge program, so The first round of the grant program concluded the first part of this year, and a second round is now open right now. Applications were due July 1st, and the Public Service Commission is evaluating those applications right now. The Public Service Commission also has $13 million available through a reverse auction of the Nebraska Universal Service Fund support. Also, there will be approximately $80 million in ARPA, that's the American Rescue Plan Act capital projects funding, for Congressional Districts 1, that's Lincoln and the surrounding areas, and 3, that is the large Pac-Man shaped district that covers a huge portion of the state. And that funding will probably be available in 2023. And then we're expecting over $100 million, that's the minimum that states will receive. But it will probably be more like $200 million, possibly $300 million through the Infrastructure Investment and Jobs Act, through a program called BEAD, or Broadband Equity, Access, and Deployment. And that funding will probably be available in very late 2023 or 2024. There's a huge process that states have to go through to get that funding. And since I brought up congressional districts, it's probably not fair to not put a map up to help you visualize this. So broadband funding from the Capital Projects Program, Capital Projects Fund, will be going in the red and green areas in Congressional District 1 and 3. And in the blue areas, I'll talk a little bit more about this later, the funding will go for community facilities in North and South Omaha. So, and that was the legislature that decided how that funding would be divvied up in LB 1024. So one of the stipulations for getting some of the broadband funding, the 100 million plus through the BEAD program, is that the Nebraska Public Service Commission will have to develop a 5-year broadband deployment plan in order to receive that funding. So that's good. That will give us a roadmap of how we're going to coordinate this funding and how we're really going to address and make sure that everyone is connected in Nebraska. But the plan requires local involvement from communities and other stakeholders. So, you know, if you are interested in being involved, there are opportunities for you to talk to the Public Service Commission, to be involved in their planning efforts, and to make sure that the needs of your communities and the needs of aging adults are met. One other big barrier to connectivity is affordability. And there is a relatively new program that is helping to address this. It is the FCC's Affordable Connectivity Program. And this program provides discounts of $30 a month for broadband service. It can be either for a home service or mobile service, one kind of service, only one per household. And on tribal lands, the discount is up to $75 a month. So it's a much larger discount on tribal areas. And the program also provides for a one-time discount of up to $100 for a laptop, desktop, computer, or tablet purchased through a participating provider. Approximately 47,000 Nebraska households have signed up for the program out of approximately 260,000 households who are eligible. So that's about 18% of eligible households in Nebraska who have signed up for the program. So there's certainly room for improvement for the enrollment figures. There are opportunities to, I think, improve participation, and we could probably do a better job of getting the word out about that program. Households are eligible for the Affordable Connectivity Program if their household income is at or below 200% of the federal poverty guidelines, or if a member of the household meets at least one of the following criteria. And I'm not going to go through and read all the criteria. I think you all have access to the slides. If you are interested in the criteria, you can read it and get your information there. So another important point, I think, is that provider participation in the program is voluntary. Not all providers are participating in the program. When I looked at the list of Nebraska providers, there are quite a number of Nebraska providers. Look like almost all the big ones are participating, and a lot of the small ones also. And broadband providers who get funding through the federal programs that I mentioned are required to participate in the Affordable Connectivity Program. So that is certainly encouraging them to participate. And more information on the program is available at fcc.gov/ACP or affordableconnectivity.gov. And so if you know anyone who is eligible for the program and might be interested in applying, I encourage you to let them know about this program. So next I'm going to talk about funding for digital equity. And Congress, the Nebraska legislature, and Governor Ricketts have recognized that digital equity efforts are important. So the state of Nebraska is applying or will apply for various pots of funding to support digital equity, including $35 million from the ARPA Capital Projects Fund for multi-purpose community facilities which enable work, education, and health monitoring and qualified census tracts in Omaha. So those are in North and South Omaha. And again, that's the pot of money that is going for broadband in 2 of the districts, but in North and South Omaha, this is going for multi-purpose community facilities. The state is also applying for $600,000 from the Infrastructure Investment and Jobs Act through the State Digital Equity Planning Grant Program to develop a state digital equity plan. And that will be my job for the next year or so, be heading up that planning effort. So I'm excited about that. And once the state has completed their state digital equity plan, then the state can apply for $7.2 million or possibly a little bit more. That's the minimum the states will receive over 5 years to set up a state digital equity grant program. And so that will probably start in maybe very late 2023 or probably more likely 2024. So this digital equity planning grant is expected to start in late September of this year. So we're making plans to gear that up. And that will guide the development of a state digital equity grant program. So if you're interested in applying for the program, then I think it would be really beneficial to participate in the planning process to make sure that the needs of aging adults are included in the state digital equity plan. And I'll talk a little bit more about how you can participate in the planning process in a little bit. So the digital equity planning process is going to focus on 8 covered populations. And combined, the covered populations comprise almost 3/4 of Nebraska's population, almost 75%. So this effort is really not just focusing on a minority of people, it's really the majority of Nebraskans. And the largest covered population is those living in rural areas. Those living in rural areas comprise 36.2% of Nebraska's population. And then the next largest group is those who are 60 years or over, 22.5%. So percent of the population. So our efforts will definitely be focusing on those 2 groups. Other groups that are included and that we'll be focusing on are racial or ethnic minorities, those in low-income houses, those with language barriers, those with a disability, veterans, and incarcerated individuals. And, of course, individuals may belong to more than one of these covered populations. So digital planning activities will include working with the regional economic development districts to develop regional digital equity plans, listening sessions on the covered populations, including aging adults, an inventory of digital equity assets and best practices, and a state planning conference to bring together those who have been involved in the planning process to share their findings, their recommendations, and their goals, and to provide input on state recommendations. So, and I'd really like you to invite you to participate in these digital planning efforts by first spreading the word about the Affordable Connectivity Program, by sharing information on digital equity assets and best practices. If you know of any, please let me know. By participating in or hosting listening sessions, by participating in regional planning groups, or submitting comments on the draft digital equity plan, which will be available prior to submitting it to the federal government. So I'm looking forward to hopefully working with many of you and learning from you, because together we can make life easier for those who are not connected, especially older adults. So if you have any questions, please contact me. If you'd like to participate, please contact me. My contact information is on the last slide. Yes?
And there is a question that has come in. This individual wants to know the name of the study regarding remote patient monitoring and COVID-19, where 32% less patient hospitalization was realized.
I could find that. I don't have that offhand, but I could send that to Antonio. But yeah, it is an incredible study. Well, I shouldn't really say incredible. I think it's a very striking study.
Okay. Another question's come in. It's just saying, are you currently working with educational institutions on developing more user-friendly technology?
That is a good question. We currently are not, but I know technology is sometimes not very user-friendly. And, certainly for those that have any kind of a limitation. So I think that's something that should be considered, but no, we currently are not.
I have a question. And you mentioned, and certainly the research supports this, that people that are 80 years of age and older tend not to be users. What can we do to help bridge the gap? So some of those folks, they might only be 80. 80 can be young for them. They might live another 15, 20 years. So how do we bridge the gap so that if they want to go to Rocky Mountain National Park, if they want to, when they're traveling in Norway, to do what you've suggested, how can we bridge that gap?
My parents are 85 and 86, and especially my dad really struggles sometimes now to use the technology. And he's a retired electrical engineer, so he used to be quite good, but he's had some health issues, and it's more of a challenge for him. It really seems like it's depending on the adult, but it may take a lot of hand-holding, a lot of one-on-one technical support, and so that's probably going to be the best solution for those that really struggle. Sometimes it can be an issue with having a bigger screen or a device that has bigger keyboards, things like that make it easier. Yeah, I don't think there's an easy solution.
All right then. Well, if If there are no other questions then, Ann, thank you
Okay,
so
thank
much.
you.
We have one more question.
Oh, we do have one more question. Go ahead. Go ahead and
Yeah.
shout it out.
Okay. Is satellite availability in rural areas comparable to cable internet in terms of speed or quality? And generally, are consumers happy with it?
Starlink is offering low Earth satellite service, and this is different than the traditional geostationary satellite service that people may have experienced. It is much faster. They have better upload and download speeds, and in general, people seem pretty satisfied with it. It's probably comparable to a lot of cable service, depending on where you live, especially in rural areas. It's probably comparable. The big disadvantage is the price. The prices just went up, so I think it's like $550 for the equipment, and it's over $100 a month for a monthly subscription fee. So that is probably the big drawback. But in general, people seem like they're pretty happy with it, especially if they don't have any other good options. So do we have another question?
Yeah, another question is, how is digital equity defined? One slide showed a bar chart. This person was interested in how the percentages were defined.
Those are from the Census Bureau. They came up with those. So, and there is a website that shows all the figures for states.
And did they have any, is there any follow-up, like, just on how they define digital equity, or did they have a specific, I think this person's they're asking more about like a definition?
Well, the official definition is that, digital equity is achieving parity in access and use, so that everyone can use broadband technology. Okay.
Yes.
Okay, here's another question. Says, just to be aware that in Omaha, the broadband providers, specifically Cox Communications, are preventing those who have been accepted into the broadband program to have their bills reduced. From my experience, they require an online account to be set up first, but that's impossible for many who did not have internet access to set up the account, or those who have a guardian and need to set up the account with customer service. And this person says it's just another hoop.
I wasn't aware of that. That doesn't surprise me. It is. Yeah. My parents were having problems with their phone, and I was trying to help them. And it definitely is can be a challenge when you're not on their account, and yes, if your internet is not working at the time. So. Yeah, I wasn't aware of that, but I guess I'm probably not totally surprised, because sometimes the telecommunications companies, the cable companies don't make life easy for consumers, so.
As a follow-up to that question, and that was a great question, whoever raised it. So if you are having difficulty working with, whether it's a cable company or a phone provider, who's your next step to contact? Would it be the Public Service Commission, or who else could you contact to be able to say, look, we're not able to get this particular whatever set up? Is there someone that can run interference? Maybe that's the better way to ask it.
Yeah, both the FCC and the Public Service Commission have take consumer complaints. And so if it's related to the Affordable Connectivity Program, I would try to contact the FCC, but if it's just general phone service, you could go to the Public Service Commission, and they might be able to help.
Very good. Thank you.
then.
Well,
Okay.
Ann, thank you so much for a wonderful presentation. We greatly appreciate your time and expertise.
Thank you.
Thank you so much. And again, for those of you that are interested, Ann's slides can be found on the website. We are now getting close to taking a short break. We will return at 10:30, and when we return, we will have two wonderful speakers presenting on elder mental health and depression, Dr. Nancy Meyer and Lori Thomas. So again, we'll break away for a short break. We look forward to seeing you close to 10:30. Thank you.